I think we've heard a lot about the risk to children, and that's been a big discussion because of kids going to school, still kids, some in remote learning. If children are lower risk for severe cases of COVID, why do they need to be vaccinated?
So most children are at lower risk for severe cases, but there are definitely children who have high-risk conditions, and many of those children are too young to be vaccinated even now. In this country, we've seen somewhere around 500 children die of COVID. The estimates range 300 to 600 children have died of COVID. And in our hospitals here in Charlotte, we have had throughout the winter, many children become severely ill with COVID in our ICUs, and we've had deaths in our community in children from COVID-19. So even if your child is in a low risk category, getting vaccinated will protect their peers at school, their peers in the neighborhood, children in our community who are too young to get vaccinated or might not have the immune system required to get the vaccine.
And I'll just add to that, I so many of my teen patients, they're really looking to protect particularly their younger siblings who live in the home with them who are too young to be vaccinated, like Dr. Olmstead mentioned. And I'll just also add another number out there. There have actually been 1.5 million 12 to 17-year-olds who have gotten COVID-19 during the pandemic in the U.S., which is just an astounding number. And then the other piece I'll add is that we also have patients who are younger. They may have had sort of a mild disease. They can have those pretty bothersome sort of longer haul symptoms like Dr. Olmstead mentioned, or even more minor things, but that are bothersome, like their sense of smell never comes back normally again. And so again, we really want to protect kids from that. And it also can give them the peace of mind, give parents the peace of mind. They can be more confident their kids are going to be safe as they're doing things that are so important for children and teens to be doing. Hanging out with their friends, going to summer camp, going on family vacations, playing sports, making sure as many of our kids as possible are back in school in person, and people can feel much more confident that their kids are doing those things and that they're safe and protected from COVID-19.